This is a PowerPoint presentation on the scope and standards of nursing practice by Amy Popa for Nursing 321 with Patricia Shedd. The scope and standards of nursing practice are authoritative statements of the duties that all registered nurses, regardless of role, population, or specialty, are expected to perform competently. These standards of care guide the nurse in his or her practice. RNs use critical thinking to apply the best available evidence and research data to diagnose and treat conditions. These standards are also subject to change as nursing dynamics and patterns of practice change within the healthcare setting. Nursing standards are valuable to patients because nurses are at the forefront of quality care. Nurses play a critical role in ensuring patient safety and quality measures by using scope and standards of practice. Commentators have long noticed that nurses in general are the healthcare providers who take initiative in providing patient care. They are the key factors in facilitating communication between the patient's family, and other healthcare providers. Standards of competency in nursing help protect the public. Standards of nursing practice, as defined by the American Nurses Association, are divided into two components: nursing process and professional performance. Standards 1 through 6 relate to the nursing process and include Standard 1, assessment. The registered nurse collects pertinent data and information relative to the healthcare consumer's health or situation. Standard 2 is diagnosis. The registered nurse analyzes assessment data to determine actual or potential diagnoses, problems, and issues. Standard 3 is outcomes identification. The RN identifies expected outcomes for a plan individualized to the healthcare consumer or situation. Standard 4 is planning. The registered nurse develops a plan that prescribes strategies to attain expected and measurable outcomes. Standard 5 is implementation. The registered nurse implements the identified plan, including coordination of care delivery, health teaching, and health promotion. Standard 6 is evaluation, where the RN evaluates progress toward attainment of goals and outcomes. These standards describe a competent level of nursing practice demonstrated by the critical thinking model known as the nursing process. Standards 7 through 17 relate to professional performance in the nurse and describe a competent level of behavior in the professional role appropriate to their education and position. These professional standards include ethics. The registered nurse should practice ethically. Standard 8 is culturally congruent practice, where the nurse practices in a manner that is congruent with cultural diversity and inclusion principles. Standard 9 is communication. The registered nurse communicates effectively in all areas of practice. Standard 10 is collaboration, where the RN collaborates with the healthcare consumer and other key stakeholders in the conduct of nursing practice. Standard 11 is leadership, where the RN leads within the professional practice setting and the profession. Standard 12 is education. The nurse seeks knowledge and competence that reflects current nursing practice and promotes futuristic thinking. Standard 13 is evidence-based practice and research. The nurse integrates evidence and research findings into their practice. Standard 14 is quality of practice. The registered nurse contributes to quality nursing practice. Standard 15, professional practice evaluation, is where the nurse evaluates one's own and others' nursing practice. Standard 16 is resource utilization, where the registered nurse utilizes appropriate resources to plan, provide, and sustain evidence-based nursing services that are safe, effective, and fiscally responsible. and Standard 17, Environmental Health. The registered nurse practices in an environmentally safe and healthy manner. The Nurse Practice Act, or NPA, differs from the American Nurses Association scope and standards in that NPAs vary from state to state. The most important function of the NPA is to define the scope of practice for nurses in the state to protect public safety. The practice of nursing is a right granted by a state to protect those who need nursing care. The guidelines of the NPA and its rules provide safe parameters within which to work and protect patients from unprofessional and unsafe nursing practice.